WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Prevention is better than cure. This phrase has never felt more accurate than today, since no treatment or vaccine is available for this disease. This pandemic is defining global health crisis of our time and greatest challenge we have faced after World War II. Unless we act on the addressed impact of pandemic, the echoes of COVID-19 will permanently melt our shared future. The virus passes on through saliva, mucus, through coughs and sneezes, which can travel up to 6 feet. So what can we do to take precautions? There are plenty of do's and don'ts. Do's: avoid close contact with those who are feeling sick. Feeling sick? Stay at home. Cover your mouth when you cough or sneeze. Quarantine those who are not feeling well. This is the only way to prevent others from falling ill. Maintain your personal hygiene. For example, use soap, water and wash your hand for 20 seconds. First after using toilets, and you will be shocked after knowing that how many don't clean their hands after using toilet. Second, before eating anything. And third, after blowing your nose or coughing or sneezing. Use a sanitizer that has at least 60% alcohol. Don'ts: avoid sharing food or drinks. Don't share your face mask with anyone. If you share a bathroom with someone, regular cleaning and separate towels are a must. Do not touch your face when out in public. By taking these practical steps, you can protect yourself and those around you. Let's do our part.
Myself Yashasri Goyal and I am from SYBCom, and my college name is Konkan Gyanpith Rahul Nargal College of Pharmacy. Today I am talking about the awareness of COVID-19 disease. The COVID-19 disease is caused by the coronavirus, which show very common symptoms. Up to today's date, no proper vaccine is produced by any country. So, we have to take proper precautions, because precautions are better than cure. First and one of the most important thing is you should have to wear mask when you are in public place. And second important thing is you should have to wash your hands time to time with soap or sanitizer for at least 20 seconds. When you are in public place or in society, you should have to do social distancing. It means there is almost 6 feet distance in between two persons. So the spreading of the COVID-19 disease become moderate. When you are in public place, do not touch your hands to the mouth, face and eyes, because if the virus is present on the hands, it enters in the body from the mouth, face and eyes. When you are coughing or sneezing, you have to cover your mouth with tissue paper, or you can sneeze on the elbow of the hand, which can cover by the cloth. Clean and disinfect the object and surface which you touch frequently in the working place. Stay home when you are sick and take proper medicine and care. When we follow this precaution, we cannot suffer from this COVID-19.
तुझं गोष्ट हाय पृथ्वी मोलाची, हा पृथ्वी मोलाची, हाय पृथ्वी मोलाची. मन शुद्ध तुझं गोष्ट हाय पृथ्वी मोलाची. तू चाल पुढं तुला रगड्या भीती कशाची, परवा बिकुनाची, परवा बिकुनाची, परवा बिकुनाची.
Hello everyone. We all are concerned about one thing. I think you all know what I am talking about. The fastest spreading novel coronavirus. It is an infectious disease caused by SARS-CoV-2. It is transmitted by airborne particles, respiratory droplets and saliva of infected patients. The main symptoms are dry cough, high fever and breathing problem. So let us not panic and prevent further spreading of this disease.
The World Health Organization has released few guidelines on washing your hand in appropriate manner.
So medical experts are suggesting that we should not put our fingers in eyes, mouth and nose unless we wash our hands cleanly. If we are somewhere outside, then we should use hand sanitizer. Also, being hygiene is very important. While coughing and sneezing, don't directly touch your hands to the mouth. Use disposable tissue. After use, throw it in the dustbin and wash your hands. If it is unavailable, use this aspect of your bent elbow because it is unlikely to frequently touch objects. There are more innovative ways to frequently touch surfaces, like use elbow to push the door in public places and use pen to press the elevator buttons, etc. Talking about food, include lemon, citrus food, haldi milk, chawanprash, kada in your diet which will naturally boost your immunity. So, let us not be the reason to spread the virus to somebody else. Let us fight this together. Stay home, stay safe. Thank you.
Hope you're doing well in all regards. Today, the topic of concern is the coronavirus awareness. Yes, it is very important to be aware about this topic because there are rumors, myths and misinformations which spread very quickly as the information always keeps on changing. So always use trusted sources such as official government or healthcare websites and social media channels. Do not panic, calm down. About 80% people who are infected may get mild symptoms from which they will recover easily without getting hospitalized, that is being home quarantined. And about 15% may require hospitalization and only 5% may get severely ill and require management such as ventilator. Don't delay, reach out for help and get medical attention. To date, there is no specific medicine or vaccine, so the best you can do is practice social distancing, always wear mask when in public places, wash your hands frequently with soap and water, or you can use the alcohol-based hand rub. Also, keep disinfecting things which you use frequently. Let's talk about the fabric mask, which is worn by the maximum of the general public nowadays. The fabric masks can be handmade or purchased in a store. They should ideally be made up of 3 layers of fabrics. The outer layer should be water resistant, the inner layer should be water absorbent and the middle layer will act as a filter. If your fabric mask is not soiled or wet and you need to reuse it, store it in the clean plastic or resealable bag. Prevention is always better than cure. So eat healthy, take enough of rest and exercise daily. Dispose your mask properly or else it will become a source of infection for others. Replace the mask with a new one as soon as it is damp and do not reuse single-use mask. Thank you. Stay home. Stay safe.
Bye.